Hello, my name is Jasmine, and today I am going to be demonstrating how to insert a urinary catheter into a patient that has male genitalia. And yeah, I'm a student at St. Lawrence, so all right, we're going to go into the patient's room, do hand hygiene, and then introduce ourselves and tell them about the procedure before we start. So, hello, Miss Esther Bailey. How are you doing today? Good, okay, I'm glad to hear it. So, I see in your orders that you have an order for a urinary catheter today. Have you ever had one in before? No? Okay, so I'll briefly explain what it's like. I see that you have some urinary incontinence. I'm sure you're a bit uncomfortable, and the catheter is supposed to go through your urethra into your bladder, and it'll help relieve some of that pain that you have in there right now. It'll like relieve some of the pressure and suck out some of that some of that urine that's stuck in there. So unfortunately it is a little bit uncomfortable, but it can go quickly today if everything goes smoothly. So it's just something that we got to do for you. So does that sound okay? All right, awesome. So before we get started here, I'm gonna ask you a couple questions about your allergies. I'm gonna raise your bed. Okay, so do you have any allergies that you know of? Excuse me, sorry. No? Okay. How about, do you have an allergy to latex? No? Okay. And how about iodine? No to iodine either. And if not, shellfish? No? All right. So that sounds awesome. So that should be good. Before we get started here, I'm going to pull up your gown and just assess your perineal area so that we can make sure that the catheter is good to go in right now. So I'm gonna provide us with some privacy before I lift that up. So I did hear that the CNA came in here earlier to do some perineal care on you. Sorry, I forgot to check your, confirm the patient. So can you say your name and date of birth for me, please? I also am checking the name band as well. So now I'm actually going to uncover you and lift up your blanket here. All right, so yeah, sorry. I heard the CNA did do perineal care, like I said, so you should be ready for the procedure. All right, so. All right, everything looks good. I don't see any signs of redness or anything, so we should be good for the catheter today. I'm going to ask you if you can move your legs and spread them out for me. All right, awesome, thank you. We're gonna do like a little frog position. Okay, so I'm gonna get my materials ready here, and then we'll be able to begin, okay? I'm gonna move this. So, just so you know, this is a sterile procedure. So if there's any point in time where sterility is broken, we will have to restart. And we don't really want to do that. So it would really help me if you stay as still as possible. Okay, so now I'm going to take out my kit. Use this nice little trash bag right there. All right, so now I'm going to unwrap my kit, up and out, sides. Okay, I'm gonna rotate it this way. All right. Now I'm going to put on my sterile gloves before we touch anything else. All right. Wrong hand. Okay, so now I'm gonna scoot this over here and move my kit this way so I have more room to work with. So first, put this here. I'm going to put this drape in between your legs, okay? So please stay still for me. Right, excuse me. All right, perfect. All right, so next I'm gonna do a little bit of cleaning of your meatus. All right, so, oh, no, actually, maybe I should get my materials ready first. All right, so now I'm gonna do the cleaning. All right, so I'm gonna hold it up like this, gonna establish this as my dirty hand. All right, so once around. Go a little bit lower, but overlapping. And then, okay. All right. Now, I'm going to hold you up like this. Then, all right, take a couple deep, slow breaths for me, okay? It's gonna keep going in. All right, all the way to the Y. Now we're gonna blow up that bubble. All right, and I did catch that I inserted around, oh, it's coming back out, that I inserted around like 5.25 milliliters of fluid. All right. Does it want to stay? Okay, I'm gonna. All right, so now the sterile part should be finished. Let me, all right, there we go. I'm gonna tug it a bit. All right, and before I take off my sterile gloves, I'm going to make sure to secure this part of the catheter onto the leg right here. All right, now I can remove my gloves. Okay, now I can clean you up here. I'm just gonna push this away. All right, so I'm gonna under your leg here and then attach it to the side of the bed. And then you can lay back down and relax. I'm gonna uncover you back up. So how did that feel? I know it was a little uncomfortable, but did you feel any pain? No? Okay, that's good. Please let us know as soon, if you ever feel pain, as soon as possible with the call light or call somebody. So just as general teaching, please do not like pull on the catheter because there's a balloon that sits on the edge of your bladder, and if you were to pull that out, then you would probably damage some of your urethral tissue, and we don't want that. So please don't pull the catheter out yourself, and it's really important to keep things clean down here so that we don't get any infections. So you can move, you can do all that fun stuff, but just be mindful that the catheter is there. So I'm gonna put you back down. Okay. All right, so is there anything else I can do for you right now? You feeling okay? All right, awesome. So I'm gonna put the call light within your reach so you can cause whatever, and then I think that should be good. I'm gonna clean up all my materials and just roll them out with me, okay? All right, thank you, Ms. Esther Bailey. Now I'm gonna go document. And when I document, I will document how well the patient tolerated the procedure, which was fairly well. And then I will also document the size of the catheter, and then I think that should be everything. So thank you.